Hello, my name is Dr. Puru Dhawan, and today in this video we will talk about spinal cord injury. About 90% of the paralysis cause are due to stroke, but 10% of the cases are due to spinal cord injury. Spinal injury means any type of injury to your spine. It could be a fracture, a contusion or a split. If you have any kind of injury to your spinal cord, the part below it stop working. For example, if a patient get an injury to the back of the head, both their arms and leg will stop working. If the spinal cord injury is below the arm, then only their legs will stop working. In a spinal cord injury, the recovery phase is crucial as it can become a permanent type of paralysis, and recovery can be difficult if it left untreated for a long period of time. Therefore, patient with spinal cord injury should start rehabilitation as soon as possible. The spinal injury can create significant problem without proper rehabilitation and care. So with this video, I want to tell you that we cannot help all spinal injury patients. When a patient comes to science engineering with a spinal cord injury, we look for some factors with the help of which we can give treatment and medication to that particular patient. So you need to observe a few things about patient that I am going to tell you today in this video. If you have any such symptom in your body, then we can help you. The first thing we see in a spinal cord injury patient is whether they can feel touch or not. If a patient can feel, then there are chances for recovery. The second thing we look for is movement. If a patient legs are not working, but there are slight movement in the leg, it means that patient can recover. But if a patient feels nothing and can't move it all, and he just feel the heaviness, then it gets difficult to help such a patient. The third important thing we should look in a patient is the feeling of having a bowel movement and passing stool. But it is a good sign that your senses are working down there. Similarly, while passing urine or before urinating, a feeling of heaviness means that there are sensations in your bladder. If we observe such thing in a patient, then only we can start their treatment. But if these things are not present in the patient, it is hard to get recovery in them, and even doctors are not very keen in taking up such cases. So these were the signs that we look in a spinal cord injury patient before starting their treatment. But sometimes reports also tell us very clearly whether we have to give treatment to this patient or not. If your spinal cord splits into two parts, then there is no chances of recovery. So we avoid such cases completely. We accept cases where we find swelling inside the spinal cord. In these cases, the spinal cord is not working due to inflammation. But once the inflammation goes away, the patient starts recovering again. This is why we go through all the report to know whether the patient is likely to recover or not. We also see some other things if your spinal cord has been injured, like your legs. If your legs become very thin, then there is a problem in the recovery. That's why we have to look a lot of things together, which will give us an idea whether we can treat this patient or not. If you are looking for the treatment of paralysis due to spinal cord injury, these things will be helpful for you. Now, you can evaluate yourself. Suppose you have an injury and feel that even after a long time of physiotherapy, you do not see any changes, even after taking all kind of therapy. In that case, there is a possibility that no medicine is working for you. We all know that no medicine can change the structure of the spinal cord. They can't rejoin the broken spine. So whatever permanent damage has been done to your body due to the injury, medicine cannot repair. It requires surgery because if your bones are too far away, vertebrae are lost and the spinal cord is split, we can start the healing process by bringing them closer through a plate with a screw. So there are different type of treatment for different condition. Wherever the body structure changes a lot, it isn't easy to treat it with medicine. Now in a spinal cord injury patient, vitamin and minerals plays very important role in the healing process. If the body is deficient of vitamins and minerals, the nervous system will not recover at any cost. we must keep our vitamin B12 and vitamin D at very good levels because they are essential for the nervous system. If your body is deficient in vitamin D, B12 or protein, you will have minimal or no recovery. So when you start treatment, you have to keep your diet good. You must eat non-veg food, especially fish and eggs, as they work great in the recovery. Now let's talk about how we help a patient of spinal cord injury. When a patient of spinal cord injury comes to us, we observe his report first. If the reports and the condition of spinal cord injury patient shows that the spinal cord is in intact condition, then only we can help the patient, because in this condition the spinal cord is not working just because of inflammation caused by the fracture or by the fall. In such cases the recovery is very quick, so we look for all these things before treating a patient. I hope you understand with this video that we cannot cure all patients with the spinal cord injury, and in what cases can we bring changes and improvement in the patient. Although there is no certainty of the patient's complete recovery, some changes can be seen with the proper treatment, medicine, exercise and diet. Therefore, spinal cord injury patients should not give up. If you keep working hard on yourself, keep working hard on your body, then you will get to see a positive result inside your body soon. So with this, I would like to say goodbye. See you in the next video. Till then, take care.